Good evening, everyone. Today is October 24th, 2018. It is 5:30. I'd like to call the order of the meeting of the Central Health Board of Managers. And since there's no citizens signed up, we won't have citizens communications. If there's no objection, the agenda will be taken in the following order. Consent agenda, then items 7, 6, 1, 2, 3, 4, 5, and 10. We'll take a 10-minute break after item 7. Agenda items 8 and 9 will not be discussed tonight, and they are: agenda item 8 is discuss and take appropriate action on the 1115 Medicaid waivers, delivery system reform incentive payment, DSRIP projects, the community care collaborative, including healthcare delivery arrangements, and other interrelated community partnerships. 9, discuss and take appropriate action on the Central Health owned property, including the downtown campus and adjacent properties. Let's go to the consent agenda. C1, approve minutes for the following meeting of the Central Health Board of Managers. A, August 15th, 2018, and B, August 29, 2018. C2, receive the August 2018 investment report and ratify Central Health investments for August 2018. C3, receive a report of the August 2018 financial statements for Central Health as presented to the Budget and Finance Committee. C4, receive a report of the August 2018 financial statements for the Community Care Collaborative as presented to the Budget and Finance Committee. C5, approve an interlocal agreement between Central Health and Travis County for certain supportive services, including cash management and investment services, legal services, risk management services, and television broadcast services, as recommended by the Budget and Finance Committee. C6, approve and direct the Central Health appointees to the Community Care Collaborative Board of Directors to approve an amendment to the agreement between the Community Care Collaborative and Integral Care for Behavioral Health Services to include school-based behavioral health services and to increase the compensation available to Integral Care by $420,000 for these services as recommended by the Budget and Finance Committee. C7, approve an increase to the Central Health fiscal year 2019 member payment to the Community Care Collaborative by $420,000 as recommended by the Budget and Finance Committee. C8, approve an agreement between Central Health and ARC Abatement 1 Limited for asbestos abatement services and selective demolition services in an amount not to exceed $1,124,500 as recommended by the Budget and Finance Committee. C9, approve an amendment to the agreement between Central Health and Braun and Butler Construction to add exhibits that reflect construction documents and the guaranteed maximum price proposal of $1,935,525 for construction phase services to be performed in connection with the installation of the alternative utilities on the Central Health downtown campus as recommended by the Budget and Finance Committee. C10, approve an interlocal agreement between Central Health and Regional 8 Educational Services Centers for cooperative purchasing services offered through the Interlocal Purchase System TIPS program as recommended by the Budget and Finance Committee. C11, approve a sublease agreement between Central Health and the Integral Care Collaborative for approximately 9,000 square feet of office space to be utilized by the Central Health Joint Technology staff as recommended by the Budget and Finance Committee. C12, approve a resolution recognizing Central Health's strategy and planning staff. C13, approve a resolution recognizing Central Health's communications and community engagement staff. C14, receive a report of the preliminary September 2018 financial statements for Central Health. And C15, adopt the fiscal year 2019 Travis County Healthcare District Investment and Collateral Policies and Procedures as presented by Travis County Investment Management Department. Do I hear a motion? Yes, Ms. Valdez.
Could I ask that we pull C6, C7, and C11?
So C6,
C7, C7,
C6, C6, C7, and C11.
right, and 6 and 7 are the same, basically.
I'm sorry?
Six
They're
and seven.
related, yeah.
So
They're
6, 7, and
addressing
11.
the same issue,
C6 and 11. All right,
6, 7, and 11.
all right. Can I have a motion? I'll entertain a motion.
So moved.
Second,
Well, can you tell me which one?
Yes, I move that the Central Health Board of Managers approve the consent agenda items, C1, C2, C3, C4, C5, C8, C9, C10, C12, C13, C14, and C15.
Do I have a second?
second,
Second. Any discussion? Seeing none, the motion's on the floor. Board Member Valdez made the motion, seconded by Board Member Greenberg. All in favor say aye.
aye.
Any noes? Any abstaining? Okay. Motion passes. All right, so we're going to go ahead and take C6 and C7 together, Holly? Okay. All right, let me read those. Approve and direct the Central Health appointees to the Community Care Collaborative Board of Directors to approve an amendment to the agreement between the Community Care Collaborative and Individual Care for behavioral health services to include school-based behavioral health services and to increase the compensation available to Individual Care by $420,000 for these services as recommended by the Budget and Finance Committee. C7, approve an increase by the Central Health Board to the Central Health fiscal year 2019 member payment to the Community Care Collaborative by $420,000 as recommended by the Budget and Finance Committee. So I'll entertain a motion to approve those two.
So moved.
Okay, second, second.
I'll second.
Okay. All right, so I have any discussion? Ms. Valdez?
I'd like to know if there's somebody here from AISD or Individual Care, and I see Alan's here. I was wondering if
Ms. Richards, would you step up to the table, please? And you, thank you both for coming. I know it's a dreary day out there, it's wet and ugly. Thank you
Happy to
for
be here.
Hi,
being
good
brave
evening.
souls.
Ellen Richards, Chief Strategy Officer for Integral Care, and I'm here with,
Hugh Simmons, the Director of Child and Family Services for Integral Care.
thank you very much. I was reading this information last week and had some questions with respect to how this worked with AISD, this specific program, and come to find out that this is in the, I guess under Dr. Gilbrand and Tracy Spinner's office.
correct, Comprehensive Health Services.
Yes, like the medical director's office. And so I had some questions. I wanted to know what population was being targeted. I read the background information that was provided to us, and in there it said that there's of the 100%, I guess, student population that's being addressed or served, there was 30% that were uninsured, the rest were insured, and that was the various mix of information, agencies that you provided information about. But I didn't know whether there was anything that separated or designated whether anything was in the special ed department for AISD or regular ed students. So I was curious to know about that because, and I also, do you want me to ask all the questions first or?
Why don't we just take them one at a time, that'll probably be
Okay.
easier for us.
Okay,
I did watch the recording from the Budget and Finance meeting to understand the questions that you had about Title V. And we did reach out to AISD to try and secure an answer to your question about the Title V specifically. I wasn't successful in connecting with the right people at AISD before this meeting tonight. But my understanding is that we do have a little bit of information about what we do in terms of behavioral health intervention plans. And so we can share with you sort of our interaction with it, but we can't really respond to your questions about the law and the requirements of school districts and things like that that you seem to have, and where this intersects with that.
Okay, so with respect to that, I still have my feet in the fire over with AISD with respect to special ed and the juvenile justice system. Our kids that are in that realm that do have a lot of needs and require a lot of resources. And so with respect to that, and I also have ongoing concern about agencies that get contracts with governmental institutions, and there doesn't appear to be any formal accountability for their performance in these annual contracts. And I noticed in here, you said y'all are part of a team. Here on your presentation, you're part of a child study team with counselors, community and schools, and administrative staff. In addition, that you use the CANS system for assessment,
That's correct.
and also that you do to test the child's strengths and needs, and also the life satisfaction scale is used to determine at least a preliminary mindset of the student. Are you all, in fact, a part of that team?
Well, when you're saying, so the team, I'm not
Because
sure
that's
what
what it
team.
says here.
So,
She's talking about the, that we work with the others on the campus.
oh, I see, with the other service providers on the campus.
Right.
And with the
Yeah,
staff.
absolutely, yeah. So we work with whatever other service providers are on the campus, and then we work with AISD, educational staff, and nursing staff as well on each campus. So and it's collaborative, it's typically based on student need and kind of what's going on a particular campus. So I would differentiate that from the BIPs, because I think that's an important piece where that, right. So that's instituted by AISD, that's by educational
By law.
staff. And if we're invited to participate in those, we will absolutely participate in those, but that's not something that we institute. And so we're not a part of a recommendation process. We might just report on the services that we're providing for a given youth.
Which is one of the things that raised a concern for me, because in the request for this $420,000 that would have been, I guess, to complete the $2.2 million grant, this was a district project, correct?
Correct, so this was.
With whom
It was a Seton project.
and what happened?
So Seton just made a decision not to move forward with the project. We were a subcontractor to Seton to perform the project for them with AISD. So it was a district project between AISD and Seton.
Okay, so do you all ever work with the kids that are within AISD or other school districts that have behavioral and emotional needs that sometimes find themselves in the juvenile justice system?
Yes.
So you go to Garner Betts and meet with the families and the student, or how does that work?
We will travel to meet with a young person and family wherever we need to travel to meet with a young person and family. So it really depends on the need of the family. So typically what we try to do is meet with a young person and family on the school campus, but sometimes transportation is an issue. And so our therapists do travel.
Okay, so is it a therapist that actually meets with them, or is it a case manager?
Therapists. Case management is embedded in the therapeutic services we provide. So all of our services are provided by
Remember all this.
licensed mental health
I think we're a little
professionals.
off topic. We're not posted for those questions.
No, that's part of the services that are being provided in this contract. Is that not the case?
Case management is an embedded part of the services that our therapists provide.
So it's actually, if you see how they work with administrative staff and counselors, and that's,
I'm getting word from council that it's about other districts.
I'm sorry?
You're asking
Well,
questions
I'm
about-
asking about AISD. Then, thank you. I'll limit it to AISD. So, because this contract is not for other districts, it's for AISD. But with respect to AISD, I have worked with this population for a long time, and I was concerned about the fact that you were not requesting that there be outcomes for, or measurement for this school year, 2018, 2019. And since this, I guess maybe I'm misunderstanding what you're stating here. On page 3,
Mr. Fuson wants to respond.
Please go ahead, ask the question, but I'll respond.
okay, so what you were asking for is, in order to keep these services in effect, and how long have they been in effect?
We have been providing these services as a part of this since December 2014.
Okay, and that's been part of the child find, I mean, not the child find, the child study team?
It's not a formal part of the child study team. We're on campus and we work collaboratively with units and other staff and other providers on campus, but we're not formally a part of the child study team.
Okay, I guess because it says it in here, I assumed that you all were, that's why we got all this additional information.
We will work with the child study team.
You will,
Sure.
but you have been doing that, or you have not?
Well, it depends on a young person and it depends on the campus. If we're requested to participate, and then we will participate in these kinds of things, yeah. But it is not a formal, this is how we operate all the time with every youth and every campus.
I support the provision of behavioral services and supports to all our students in need, in anywhere, but here in AISD, of course. But I want to make sure that if we were to do this, that we were going to do this and have some kind of baseline for outcomes or reporting mechanism in place. One of the things that and speaking to some of the administrative staff and
Yeah, I think, yeah.
If I may respond to that request. So, one, just to remind the board, this is a temporary stopgap measure just for the school year. So Integral Care is currently funding these services right now out of their funds. And so we're coming in along with other funders. Second, with respect to the measures in exchange for that funding, we're working with Integral Care to amend their contract that they have with us through the CCC to report on what you can report on, but also you're bringing in a PhD whose name escapes me, but you're having somebody come in and evaluate this program, I believe.
someone from the UT
Based on,
LBJ school.
what are the overall outcomes for the patient served? And so we're getting for such a short period of funding, we're trying to get as many metrics and data points as we can, because if this is something that might ultimately be a strategy for our mental behavioral health here in Travis County, intervening early on in people's lives, then we'll obviously need those data points. So it's not just an allocation of funds. We are executing a contract in exchange for the data points as well as the services rendered. So I need to clarify that.
And just to address your concern, I'm not aware of any contract or arrangement that we have, that Integral Care has with any organization where we aren't required to be accountable for the funds spent. So we have more than 80 contracts for different funding sources and different programs, and in all of those we're required to report to the federal, the state, the local governmental entities we partner with, as well as private funders.
I think what I need to do is clarify, I may have misspoken in that I wasn't talking about necessarily, because of course you have to account for your funding. What I'm doing is accounting for the success of the program, and that means the performance with the students, the students that you're serving.
So I would like to, so let me speak to that. So we have, the only type of measurement I think you're speaking to right now that has been done on this program is in partnership with AISD, and what they have done is drawn a sample of students out of our program and then compared them to a sample of students that are not in our program and looked at the results in terms of things like attendance, disciplinary actions, things like that. We are currently in the process of applying to be a research partner with AISD so that we would have access to information that we think would provide a more accurate picture of what happens with the students, so that we can look at students before they come into services, while they're in services and then after they receive services. And that would be, we think, a better way to determine how well how well the services are performing in terms of improving student outcomes.
That actually is a better way, because that's what we suggested years and years ago, maybe a decade. And in the development of looking at the peer system of being integrated and dealing with the juvenile justice system, but also looking at how special education resource services are being provided to students or 504 students or the regular special ed students, and those that don't speak English as a primary language. Because all these things come into play, and you do find that those targeted students, especially those that are under a BIP, that is not, I guess, provided to all the people that touch that child. And you're very familiar with what that means, because you all help develop that with your annual plans and the other students. That coordination has to occur. And we were advocating for that many, many years ago. And apparently it appears to still be a problem. And so my request and my suggestion, I've got a lot of other questions, but I would like to say that the reason I am making these comments is because we are in a mode whereby we have to look at how our dollars are spent, and we want to make sure that they're effectively and efficiently spent. And since we are partners with you and with AISD and with other governmental agencies and service providers, what we need to do together is develop comprehensive and coordinated plans, integrated plans, so that that student receives and the family receives all the services that they are eligible for or could help them have a more positive outcome with their lives. And that's a big, big request. We just haven't, to my knowledge, don't have a formalized process for that. And I'd like to know that if we were to fund this, that there would be an understanding that could be the opportunity that we would all have as institutions providing services to our students to look at the development of a plan that would continue to address all the needs of our students, but in an integrated fashion so that they're not siloed. And so when I have our kids whose therapists or case managers or coordinators from any of the AISD departments going to Gardner Betts or going to something, and they're supposed to be meeting with Integral Care is there. Thank you, Moran, that they have some assurity that all the partners that are supposed to be present in those meetings are present, so that the families and the other persons there are, don't have to, it wouldn't be a fruitless meeting. And
If you don't have any more questions, let's move on. Because
well, I actually do have a lot of questions, but it doesn't.
We have a long agenda. And
Okay,
we've got to move
that's
on.
that's fine. All I'm going to do is end by saying this.
What I'd like
I support this effort, but I cannot vote for this funding because there has to be some language that will talk to and include the performance component for how these kids are addressed, and AISD has to be at the table to be able to address that. I'm sorry, y'all are here, but they're not.
Manager Walters, why don't we have you set up a time with you and Ellen so that you can have your questions answered. We really need to move on. Board
That's
Manager Musaitis?
You said what I wanted.
Okay. Mr. Giesland?
No, I just pointed out that, earlier, we're working on this contract, so through the CCC contract that we have, there will be performance metrics in there, but while this is not spelled out in this particular, or won't be spelled on this particular contracting situation, there is a working group that's currently looking at what does the longer term beyond just the school year look like? And you've got a number of people at the table, including different funders as well. So that effort is underway.
Well, I'd like to be included, at least to be able to talk to someone and see how they're going to do that. I used to sit on CCAC.
That's an effort that's being
So,
led by
with
AISD.
That's right. I've spoken with their administrators today.
Sure, there's a motion on the floor. Manager Bell made a motion. Manager Musaitis made a second. All in favor, say aye.
Aye.
All against no.
No?
Okay. Anyone abstaining? Okay, so show that Manager Jones abstained, Manager Valdez said no, and everyone else. So the motion passes. Thank you, Manager Valdez.
Thank you.
All right. C11, approve a sublease agreement between Central Health and the Integral Care Collaborative, ICC, for approximately 9,000 square feet of office space to be utilized by the Central Health Joint Technology staff as recommended by the Budget and Finance Committee. I'll entertain a motion.
I so move.
Okay.
Second.
Okay. All right. Is there any discussion on that one? Manager Valdez.
With respect to the joint technology staff, who is that encompassed? Who is part of the joint technology staff? Is that different, CCC, Central Health?
So the joint technology staff is essentially the staff that works and reports to John Clark,
So it's Central Health staff.
Central Health, but they serve the enterprise.
And they serve the enterprise, and they're working with ICC?
Yes, they co-locate in the same space.
So they're currently co-located in the same space. And they need 9,000 additional square feet?
I don't think this is for additional square feet. This is a renewal of the existing lease.
Correct.
Oh, okay.
That's correct.
Okay. So that's where they are housed, and we're just going
Yes.
to ask them to continue to renew.
Yes.
Thank you.
Any other discussion?
It exists.
All right, all in favor say aye.
Aye.
All against say no. Anybody abstaining? That's a show the motion passes. All right, so let's move on to agenda item 7. Remember, we're taking these out of order. And for the future, on the consent agenda item, guys, if you could do a little bit of research and talk to staff first, it just helps to have, we don't have such a long discussion. Consent agenda items should be exactly described. We should be able to move on quickly with those. Otherwise, we're going to take too much time.
May I just say one thing, sir?
Yes, Manager Valdez.
Okay, so I asked for additional information, and I, on my own, went out and approached and spoke to the staff at AISD, and the people that are actually in charge of it, Dr. Tracy Spinner. And I did not speak to her boss, but I spoke to Tracy, and I spoke to Dr. Jean Behay, who's the new special ed director for AISD. And I spoke to Dr. Paul Cruz's office, and I spoke to my trustee. And there's an ongoing effort.
Holly.
So I understand that you're responding to what manager,
So I guess the bottom line is what I'm going to say is I did as much research as I possibly could without actually being in their offices to get a copy of what is it they're talking about. And that would be good for us to have as backup material for future projects or agenda items.
Thank you, Manager Valdez.
Thank you.
Agenda item 7, discuss and take appropriate action on the agreement between Central Health and Foundation Communities for health insurance enrollment and case management services. Kit and Mary, can you come to the table?
Good evening. We'll be brief. You all, Board of Managers, received a memo in regards to an RFP that we submitted in September for health insurance enrollment services during the open enrollment period, as well as navigation services for those with complex medical needs or enrollment needs. So we are here tonight to request your approval for an agreement between Central Health and Foundation Communities to provide these services for an amount not to exceed $200,000.
Do I hear a motion?
I move that the board approve an agreement between Central Health and Foundation Communities for health insurance enrollment and case management services in the amount not to exceed $200,000.
Do I hear a second?
I'll second.
Okay. Discussion. Anybody got questions? Ms. Rose, Board Member Roses. Member
Yes.
Roses.
Foundation Communities, staff, that's gonna be conducting the enrollment and troubleshooting of the complex medical, needs of the Travis County residents. Are they, what is their training gonna look like? Just curious. The training.
I don't have specific, I mean, they address their training in their proposals. And you have the evaluation criteria that we used. There was 5 evaluators on the committee from diverse backgrounds and diverse roles in the organization that reviewed the proposals, and you can see the components that we reviewed them on.
Are they gonna be paid?
Are the not-
people providing these services gonna be paid?
Not all of the folks will be paid. In their proposal, Foundation Communities does utilize trained volunteers during the open enrollment period to provide enrollment into the health insurance marketplace.
I understand that, but, so are we saying then that those that are not gonna be paid are the ones that are doing the enrollment during that period? And then after the period, the Foundation Community staff will,
Yes.
those are paid staff that will
Yes.
continue to get paid,
Yes.
but they will be the ones that are,
Yes, during for the year-round services. Is that, you're asking for if the ones
Yes,
that do
yeah, I guess.
for the complex enrollment needs?
well, complex enrollment needs are also, during the enrollment period.
Yes, it happens both.
That's right.
We've got it during the enrollment period,
And during the
and then
outside.
outside of it, folks lose their tax credits, they receive medical bills, there's all kinds of issues that arise that
Blended
we
families,
do troubleshooting for.
okay, so, are they going to be doing any outreach or education?
This RFP did not address, we are not funding outreach and education. Central Health has funds, we will be doing our own marketing campaign and developing marketing materials, which folks can have access to, but the RFP in particular was
enrollment.
looking for enrollment.
Okay, and we will have sufficient culturally and linguistically volunteers, qualified, certified volunteers to do these enrollments?
Yes, on the proposal that they put forward, the group was confident with the capabilities.
Okay. I appreciate them having submitted their application and being selected. It was my hope when the Central Health got into the business of funding that we would be looking at this as also an opportunity to build economic opportunities for the people who would be employed to provide this enrollment service, so that those staff members could be providing a livelihood for themselves and for their families. So it's helping build up the community, it's helping them build up their ability to support themselves, and it puts a value, to me, it puts an additional value on the service that's being provided. You're not just a volunteer, that's why I have you're also someone who's valued for the service that you're providing, and we're going to pay you to show you that we value you. I think that is something that we need to consider for future endeavors.
I'll read it.
And I just would like to have seen an entity that's a community-based entity that pays employees to provide this service. Is that not anything that would be aligned to anything within Central Health?
Yes, Mr. Goodwin.
So I think with respect to this particular contract, that's not an element that we use to score this contract, if I understand correctly.
That's
So I
correct.
think going forward, and I know that there's a policy that we need to bring back to you, the Budget and Finance or Strategic Planning Committee, to talk about partnerships, but I think within that, to discuss, to what extent are you providing economic opportunity to those that have historically either been disenfranchised or disadvantaged?
That's right.
Now, I will say that, in this short period of time that you have for not only open enrollment, is what I'm thinking about, but also just the short period of time of this particular contract, all the responding firms had to put their best offer forward. They had to put their best proposal forward, I should say. And I think utilizing volunteers, you don't have to be a volunteer if you don't want to be a volunteer. But that does expand the workforce and potentially increases our cultural competency. And I would not want to foreclose on saying, well, everybody has to be paid, you can't use volunteers, because then I think that means that we would walk away from a very valuable part of our community, and that we're fortunate to have people that want to volunteer to do this. So I don't know that that's where you're headed, but just as a caveat, we get a lot of bang for our buck with volunteers.
No, where I was headed is that as we look at social determinants of health,
So we have to
And
stay on
as-
this item, so yeah, I'm sorry.
within this item, that's one of the reasons I would have asked, that's why I asked, because as we look at the quality of life that any of our community members have in Travis County, I think it's important that we take those things into consideration for future purposes. I would have, just making my point, because I think that that is our role, if we want to be models at Central Health of what we would like to see happen and who we would like to see fund, then they should be reflective of our community. We should be valuing their performance, and we should be paying for it. Thank you.
All right, I'm not sure if I got the motion read into the record. The motion should read, I move that the board approve an agreement between Central Health and Foundation Communities for health insurance enrollment and case management services to an amount not to exceed $200,000. I don't know if it got read or not.
You don't read the motion,
I-
board member.
Okay, sorry. Did you read that? Okay, would you read it, Charles?
I'll read it again.
Thank you, sorry.
I move that the board approve an agreement between Central Health and Foundation Communities for health insurance enrollment and case management services in the amount not to exceed $200,000.
Second.
Okay, sorry. So I have a motion by Manager Bell, seconded by Manager Greenberg. We have any more discussion?
One quick question.
Yes, sir.
Is this county-wide?
Yes.
Okay, so are you in places county-wide, or are you just at one location?
Foundation Communities operates 2 sites, a north site and a south site.
But outside of those 2 sites, are there other places for enrollment activities?
In the Eastern Crescent, east of 35, east of 183, to the county line.
Actual enrollment sites, I do not recall I know when they've talked about their past enrollment activity, the areas of the community that came, that they have enrolled in the past were from our areas.
Right.
I know
my
you're
question
asking-
goes to is those who live in those areas, who do not have the capacity
Of
or not to get
transportation.
into these 2 locations, do they have access to that same opportunity?
May I
Yep.
help with this? So if you have somebody that lives in Manor, Pflugerville, out in Del Valley, would they need to get transportation to get to one of these sites, or is there a way to assist them with enrollment if they aren't able to get to one of these sites?
That is something we could talk about with Foundation Communities in the proposal. And there was not any proposal that talked about doing like home visits for enrollments. So
But they would have to find transportation to get to.
they
one
would
of
have to
these
find,
sites.
I
Or
know in the
in-person.
past, they have done phone enrollments. And, in past, there have been individuals that could not physically get there, and then they do assist with that over the phone. But that is certainly something in the contracting process that we can
talk
Counsel.
about.
Council, I see Foundation Health right over there. Can I bring them up and have them answer that question?
If they're with Foundation Communities and they can answer the question, you may recognize them to answer that question.
Would you come up? We'll keep this brief, so Cynthia, did you have a question for him?
Yes, well.
Oh, actually,
Shannon has a
Manager Jones' question.
Yeah, I'm Walter Moreau, the Executive Director of Foundation Communities, and Corey Hattemer, our Director of Financial Stability, is here. I know this may be counterintuitive, but the most important thing during enrollment season from November 1st to December 15th is that we're open 7 days a week, really long hours. And we need those sites to be staffed so that the volunteers are highly supported. And transportation is not, people can get to us, and we will have lots of transportation things we do to help, but the real challenge is time. We have to be open long hours, and even though it sounds like, well, we should have a mobile service that runs here and there, that's actually not efficient, effective, or providing quality customer service. And the important thing is that 59% of our clients, of the almost 6,000 folks we enroll in that short time frame, are identified as persons of color. 46% speak a language other than English. We are absolutely training on cultural competency and doing outreach, and we couldn't enroll that many people without doing really effective outreach. So I'm really passionate and proud of the work we're doing in 138 zip codes. People are finding us during enrollment season.
Well, I'm not questioning whether they're passionate. I know them quite well and work with them, done great work. I'm just concerned if there are a cadre of individuals in these growing communities that do not have access. Transportation, to you and I get it, we'll find that way, but there are a sizable number of people moving to these areas who can't find that way. And so my other concern is that we have a mechanism to be able to ensure that they are not left out. If there's a call-in, that would be very helpful, but what I'm understanding you're saying that's not their primary source. So I'm just a little concerned about whether or not that component is being addressed. That's where I'm going. Hopefully, as you look at these resources, you'll look at better ways to be able to address that population. I would encourage you to do that.
And we could definitely do that. I will say we do provide remote enrollment services for people who aren't able to travel to our sites. And so we can enroll them by phone. So a lot of our clients have really high medical needs and just can't physically travel, and we enroll them by phone.
You have what?
We enroll them by phone.
So you do?
Yeah.
Yeah.
We do remote enrollment services
And
by phone.
people in those areas are aware of that?
If people call and ask 211 or they call our phone number, we can share that information with them.
Okay. All right. Thank you.
And then,
You
can I
manage all
just
this.
also, Ted reminded me, because I was so focused on this RFP, we do have our Enroll ATX Coalition where multiple entities that provide enrollment services, like Community Care has ACA enrollment, Lone Star Circle of Care, other entities. We have a map on our Central Health website that has all of those locations. And anybody that calls 211 can get referred to, and then we'll also make sure, 211 knows about the phone capabilities as well.
Okay.
And 211 is the number that will be promoted in all of our media and all of our flyers around ACA enrollment.
All right. Thank you.
Thank you, Manager Jones. Manager Aldous.
Yes, thank you very much. I think that for future purposes, we need to make sure that that kind of language is included. I did do enrollments, and I did it with another agency that applied for this grant. And we went to recreation centers, we went to libraries, we went everywhere we were needed. And so I think it's important, since we're the ones that are writing the RFQ or the RFP, that we put that in there as a weight, as a scorable question that future applicants can respond to, because that is how you get in your neighborhood access to the people who may not necessarily have the transportation.
Thank you, Manager Aldous.
Thank you.
Manager Greenberg.
Yes, just to make sure I understood. So 211, which is the hotline run by United Way, right?
That we pay for, yeah.
We're part of
fund.
it, and others are too, where people call in for all kinds of questions about where they can get various health and social services, whether it's enrollment or in healthcare or SNAP or other things. So you're talking about that 211, right?
That's correct.
Okay, and you're also saying that this is only one of the ways in which people will enroll. We will have on our website the full complement of all of these locations where people can access enrollment. Is that correct?
That is correct.
Okay. Good, because I do think we acknowledge fully, and in fact, in strategic planning, we had a whole strategic planning meeting devoted to transportation. I concur that these are ongoing issues for many of our residents, and we will continue to approach with everyone how we can make healthcare the most accessible and with various modes of transportation or telemedicine or remote call-in for signing up. Thank you.
Thank you all for coming up.
Yeah, thank you very much.
Thank you.
Good, thank you. All right, so I have a motion on the floor. Any other discussion? I have a motion on the floor by Manager Bell, seconded by Manager Greenberg. All in favor say aye.
Aye.
All against say no. Any
I
abstain?
abstain.
Abstain. So show Manager Ball did abstain, otherwise the motion passes. Thank you. All right, we're gonna have a 10-minute break after, before we go into executive session. So we're gonna take items 4, 5, and 6 in executive session. Item 4, discuss and take appropriate action on the ground lease agreement between Central Health and Travis County Emergency Services District 11 as recommended by the Budget and Finance Committee. Item 5, discuss and take appropriate action on the ground lease agreement between Central Health and Travis County Emergency Services District 4 as recommended by Budget and Finance. Item 6, discuss and take appropriate action on the strategies to expand the Central Health Premiums Assistance Program related to Ideal Care offered by Sendero Health Plans, Inc. I announce that the board is convening an executive session to discuss agenda items 4, 5 under section 551.072 of the Texas Government Code, deliberation regarding real property, and section 551.071 of the Texas Government Code, consultation with attorney. And item 6 under section 551.085 of the Texas Government Code, deliberation of governing board of certain providers of healthcare services. All right, let's take a 10-minute break and go get some food.
Wish it made it so, right?
All right.
Everybody voted.
All right, it is 7:16, folks. We're coming out of executive session. Item 4 is discuss take appropriate action on the ground lease agreement between Central Health and Travis County Emergency Services District 11, as recommended by the Budget and Finance Committee. Holly.
Good evening. Most of you will recognize my presentation from last week. There are a few changes, and I'm going to tell you up front that I'm going to be a little unconventional because my slide compares ESD 11 and ESD 4, but because we're taking a vote on both items, I'm going to go through ESD 11 now, then you'll vote on that, and then I'll go through the same slides for ESD 4. So, just focusing again on ESD 11, which is the top row here. This is a lease that would give Central Health a leasehold estate in land owned by ESD 11 at 7300 Kellum Road, Austin, Texas. Central Health intends to sublease the land and any improvement it builds thereon to the University of Texas School of Nursing. So they would be our clinical partner at this location. Okay? Now focusing here on the left side, again, ESD 11 only. The term of the ESD lease, ESD 11 lease is 6 years with 3 optional 10-year extensions. We do have a due diligence period built into this, and there's a laundry list of things that need to happen during the due diligence period. I will not read them, but if you have questions, I'll come back to them later. The condition of premises, ESD 11, just like when we are the landlord, are making no representations or warranties of any nature, but they are responsible for identifying latent and patent defects through a site assessment that is performed at their cost during the due diligence period. Rent will be $1 per year during the initial term, and fair market value during any renewal term, the first renewal term starting in year 31. Remember that ownership of the building will revert to ESD 11 at that time, and they'll have all operations and maintenance responsibilities, which is the reason for fair market value. The use of space, as I said earlier, we can use the space to construct a clinic and actually operate that clinic, and our intent is for UT School of Nursing to operate the clinic. And there are non-clinical health-related services that may be provided in the clinic space as well. Subletting, of course, because we do not provide our own healthcare clinics, we will be working with partners, and so the lease allows us to sublet to third parties like UT School of Nursing or Community Care. A sublessee may only use the land for the uses permitted under this lease, so they can't open a donut shop, they must provide healthcare services. Some events of major default by tenant, not very many. Major events of default can actually force termination of the lease, but fortunately for us, Central Health, the only 2 events of major default are when we fail to pay amounts when due. I don't foresee the $1 being a problem. And if we don't use the land for a purpose that is permitted, which is the healthcare clinic. A default by landlord is actually much broader. That could occur if they fail to perform or observe any action, obligation, or condition contained in the lease. They have 60 days to cure that, and if they fail to, landlord will be required to reimburse tenant for all expenditures it made to build the improvements on the land, and we walked through that last week, what all of those expenditures look like, but it does include interest on any debt that we issue. Limitation on damages, this slide is exclusively for ESD 11. So the ESD 11 lease imposes no liability upon any member of the Board of Managers, and our liability will not exceed the amount appropriated in our annual budget. That's just a legal reason we can't create debt, and will never exceed $500,000. That's the maximum, even if we have more in our budget. And tenants interested in the premises and financing, we may pledge and mortgage our interest in the land for purposes of financing the construction of the healthcare facility to be located thereon. We don't intend to actually do a leasehold mortgage, but we have that right if we decide to go that route. And that is my presentation on ESD 11.
I'll entertain a motion now. Manager, all this.
Number 4, I move that the board approve a ground lease agreement between Central Health and Travis County Emergency District number 11 for a land located on Kellum Road and authorize Central Health's president and CEO to negotiate and enter into an agreement on terms similar to or more favorable than those presented to Central Health as recommended by the Budget and Finance Committee.
Second.
So I have a motion on the floor by Manager Valdez, seconded by Manager Greenberg. I don't anticipate any other discussion. Are there any questions? All right. Let's take a vote. All in favor, say aye.
Aye.
All against, say no. Any abstaining? Motion passes. All right, agenda item 5, discuss and take appropriate action on the ground lease agreement between Central Health and Travis County Emergency Services District 4 as recommended by the Budget and Finance Committee. Holly?
Now we're looking at the bottom part of this slide, which is the ground lease between Central Health and Emergency Services District 4. This lease gives Central Health the right to use land owned by ESD4 at 14312 Hunters Bend Road. And we intend to sublease this land and any improvements we build thereon to community care at this time. The term of this lease is much shorter than our ESD 11 lease. It is 2 years, and I've corrected with 3 optional 1-year extensions. The due diligence period that we discussed in ESD 11 also applies to ESD 4. However, there are 2 provisions of the due diligence period in ESD 11 that don't carry over to 4. And those are the requirement to agree on reimbursement to be paid and the specific outcome measures for the clinical provider. The condition of premises, again here, landlord makes no representations or warranties of any kind, and there is no requirement to perform a site assessment before we access the land. The rent here is $1,200 per year plus $100 per month. The use of space is identical to how we can use the space on Kellum Road. It is to install or place a clinic and any other improvements like a parking lot to operate a healthcare facility. Subletting, we may sublet to a providing entity. Again, the providing entity contemplated is community care. The major defaults that could occur by tenant are the same as ESD 11, but as Manager Jones pointed out earlier tonight, the major event of default that doesn't exist in ESD 11 that does in 4 is if we were to interfere with the dispatch of emergency service responders from the property. The default by landlord, again, is much broader. If they fail to perform or observe any action, obligation, or condition, except in ESD 4, they only have to reimburse tenant for the rent paid. They don't have to give us money back for all of our expenditures. And these are not applicable to ESD 4, so that ends my presentation.
Thank you, Holly. All right, yes, Manager Valdez.
I'd like to move that if you will entertain a motion. I move that the board approve the ground lease agreement between Central Health and Travis County Emergency Services District Number 4 for land located on Hunters Bend Road and authorize Central Health's president and CEO to negotiate and enter into an agreement on terms similar to or more favorable than those presented to Central Health as recommended by the Budget and Finance Committee.
Second.
Okay. So I have a motion on the floor by Manager Valdez, seconded by Manager Greenberg. I don't anticipate any questions. Any questions? Maram?
Mine is more of a comment as stated, and thank you, Holly. And I'm really happy to see that we're moving forward with established clinics in Del Valley, and that we are finally, as we've promised, we're committed to delivering services to that area, and we will definitely move forward expanding and making sure that our community, our people that we serve in those communities are receiving equitable and adequate care. Thank you.
Thank you, Manager Mosaitis. All right, seeing no other discussions, all in favor say aye.
Aye.
All against say no. Any abstaining? All right, motion passes. Agenda item 6, discuss and take appropriate action on the strategies to expand the Central Health Premium Assistance Program related to ideal care offered by Sendero Health Plan. Mr. Giesen.
Yes. Members, thank you. I'll be covering this memo not line by line, but I'll be summarizing key takeaways. And this memo was provided in your packet beginning on page 31. I'm not asking for any type of vote or action tonight. You'll recall, pursuant to the resolution that was passed on September the 22nd, that the president and CEO bring back a viable strategy. And so I'm really presenting this for your information, but also for the sake of public and transparency, this being an open meeting, making sure that we're getting all this information out there as we committed to the community that we would. So this focuses on the Premium Assistance Program. This particular report does not get into capitalization, if you will, but we do touch on it because the question is, what is viability? And we'll cover that, throughout the course of this discussion. I'm going to jump to the assessment and the recommendation, which you see is outlined in the text box there on the first page. And at present, staff, and I want to commend both all the enterprise staff. I know the Sendero team, Kit, your team, we have community care and CCC staff that have pitched in this endeavor, and it really has been an enterprise-wide effort. And also I'd like to commend Ms. McDonald for helping to steer and pull all this together as well. So, but this has been put together, and we have tested a process where we can provide MAP and sliding fee scale members a premium assistance program for purchase of coverage in Sendero. I would say that the state of operational readiness is good, meaning we've gone out to a live market, not a market with actors, but a market that we would be serving, and tested our messaging, tested our cultural competency, tested the processes. I know that we've made some changes to make it easier to connect with people from Sendero, because we've shown that once you do make that connection, application rates are very, very high. So I feel like staff has done everything they can in a very short period of time to make sure that we have a process in place that will work. I would say the overall viability for 2019 is favorable, meaning if you execute on the plan with the premium assistance as was originally designed, you will have a favorable financial result for 2019. However, in the years following 2019, and this is key, it all depends on the mix of the members and their index scores in Sendero, then the results can turn not so favorable. We have been, and this was contemplated on the 22nd when the board took this vote, but also as part of this test program that we've been in, asking people if they would like to change from MAP or sliding fee scale to Sendero. We have been emphasizing that this is not a guarantee of perpetuity, that it's only funded for a year, and it is subject to continuation of funding on this. So this is something that we have been very forthright and open about with potential Sendero members. Our recommendation is that we proceed with the 2019 Premium Assistance Program with a continued emphasis on the duration of the program being 1 year. Tentatively, the projected financial performance evaluation originally scheduled for June of 2019, and this was pursuant to the motion that you all adopted, will need to occur earlier in 2019. So I think the exercise that we would go through in June, we'll go through again in probably end of January, potentially February, March. It could be monthly, could be at each monthly board meeting. I don't want to, or Budget and Finance Committee meeting as well, but I think this is something that we are going to have to watch, because it is a very narrow range of members that at a certain index score that we need to enroll in Sendero in order for the strategy to work. Moving on through the document, there's a transaction overview there, and just to make sure that everybody understands, this is not just about signing people up for Sendero. You're actually qualifying them for the Premium Assistance Program, so it's access to dollars to then turn around and buy an insurance product. So that's a real simple overview of the actual transaction itself. But then following that through, in terms of how the federal risk pool dollars work, you have a true-up that occurs well after the end of their fiscal year. So you're really getting into summer of the following year before then you would see those transfers, if there's a net amount due to Sendero, actually take place. The operational plan, this is fairly extensive, and again, I'm just going to hit the high points here, but the way this works is that the Central Health contacts the eligible individuals, and we're reaching out through some of our partners to help with phone contact as well as person-to-person contact. We have to get an authorization to be able to, because you're talking about people's risk information, health risk information, we have to get an authorization to either let them, they can contact Sendero directly if they want, but to hand that information off to Sendero to then start facilitating that communication with Sendero. So that's key to this operational plan in order to be compliant with federal regulations regarding privacy and health information. No one is required to enroll in Ideal Care. Again, we're emphasizing that this is optional. It's certainly your choice. And I think as you'll see in the data later on, some individuals are exercising that choice to not do that. The activities today, again, I think many of those speak for themselves. And, there's some written authorizations that you have to obtain. And so this is not easy type transaction like what you see in a retail environment, which is, what are you interested in today? Oh, we happen to have water right here. That's a good example. It's not like that. There's a lot of discussion. There's a lot of disclosures that are necessary. And so all of this operational activity that you see listed here is designed to be able to accomplish that. This is only being offered to a specific group of individuals based on their index score. And so right now the universe is a little over 500, 543, I believe. And the index scores that we're looking at, we started a cutoff of 9, is that correct? 15, I'm sorry, 15. We could go as low as 9, but we don't want to, at this point, we're not wanting to go any lower than 9 again, because we've got to have that right mix of members coming into Sendero in order for this to be able to work. So I'll get into the numbers at this point, and these are as of yesterday. We closed the business yesterday. So the reason for this memo coming in on the timing like it is because we wanted to get you as fresh a set of numbers as we possibly could. But you have 543 that have a risk score of 15 or greater, and you see the breakdowns on those that are in the MAP medical access program, those that are homeless, sliding fee scale, and then those, as Kit had alluded to earlier, those that are not sliding fee scale that we cannot contact directly. So we have mailed a total of 422 letters, both in English and Spanish. And we have phone calls and the phone calls results are mixed, as you might imagine. People don't have to take the call if they don't want to, and then when they hear what it is, you have a very, very brief window, probably less than a minute, to win them over and to be able to get them to want to continue through the call. So there's a challenge there with phone calls. But the actual contact number is 130, and we've been able to schedule some appointments based on those phone contacts to the tune of 50. Now, as you follow that through, some people are ineligible. As you go through this process, you realize, okay, you're not eligible. And there's 20 that, out of that 50, that were just not interested. And, what I was advised in the briefing on this is that the answers vary. What did surprise me is the one that said insurance is difficult. I've always thought insurance was difficult. And so to see that one said that was the stated reason, not that other people didn't feel that way, but in terms of the information that was collected, I would have imagined that number would have been actually a lot higher. And then you had some that just preferred MAP, and that's understandable. They know it. It works well for them. So they just decided, we're just not interested because we like what we have. Jumping down to the status of the appointments, and this is the important point because this starts getting from application rates. And this is a precursor to what I would say is your total conversion rate. But it's over 80%. So of the 30 face-to-face appointments, if we can get them to the point where they're interacting with someone from Sendero, Sendero is very successful at getting people to make the application and to start going through this process. And so of the 30, you have 22 that completed an application. In typical marketing lead programs and insurance products, that is a very high rate. So I say that's a positive note within all of this. The average index score is coming in at 27.94. So you heard about targeting people at certain index scores. You always want to keep your average index score in front of you as a key dash metric because that has to be managed throughout the open enrollment period very, very closely. The operational impact, there's a flow chart that was handed out. If you have questions, Stephanie and Kit or Connie will be happy to answer any and all of those, but it is a very complex process that involves a lot of different pieces of the enterprise, and you can see that You know, the beauty, if nothing else, through this exercise, the great thing about this enterprise is that when it's time for us to come together and put these pieces together quickly, we can do that. And that's, I think, goes back to people that, some might be in this room, some might not be in this room yet, but are people that put all these things together, I think it's really come in strong for us here in the past couple of weeks in terms of the enterprise structure. So I'll let you just let that chart wash over you, but it gives you some idea about the complexity of how we're interacting with each other and all the data analytics that sits behind all of this in order to make this successful and power this thing. Next is the outcome measures, and this was a prominent part in the resolution that was passed by the board, in the motion that was adopted by the board. And just to sum it up, we're collecting numbers on who we enroll, who are they. We're going to report on financial results as best we can, because there's a lot of projections that have to be made, and we've seen this before in insurance, those projections can move around wildly at times. But by looking, and this gets to the viability question, by looking at, okay, who did we enroll and what's their index score? Did we get the right mix in? That's one test of viability. The other test of viability is your projections. What are we showing for 2019 as best we can show it? And then the second part of that, the 2A and 2B, 2B to that would be, what are your actual results? Now, insurance results, there's a big lag time when you're trying to true up because you haven't paid all the claims yet. And so again, we're going to do as best we can working with Sendero Management, but I'm just kind of putting everybody on notice. Now, it's really hard to report actual results in a quick fashion. And so you have to work with your actuarial firms to get some early preliminary projections, if you will. And Wes, if I'm not saying that correctly, or Connie, please correct me in that regard. We put some target membership counts going down to this table. And this table, the reason it's not filled out is, again, we just wanted to give you a flavor for what maybe the format might look like and the sorts of data that we would be collecting. But we put some target counts there for the total ideal care enrollment, and then breaking it down in relevant subtotals, and then focusing on, the subtotal that we would need to recruit or ask them to enroll in, switching from MAP and sliding fee scale into ideal care by Sendero. And then so what we report, we'll report against these targets, and so we'll be able to determine, are we executing correctly? Or is the messaging right? Is the contact process right? Is the handoff right? So these will be key indicators as to whether or not our strategy is actually working and being executed correctly. The financial framework, again, we'll pull this next table, really, it covers the 3 years. It looks at things on an annual basis, but then it gets into more detail on the subsequent table where you start getting into quarter, where we talk about the net income, the surplus, and the RBC. And that's more specific by each quarter in 2019, focusing really on first and second quarters. Because as you'll recall from the motion, you want to come back in June and take another look at this. We'll continue to provide this financial information as we have it up before June, but in June is when you'll need something like this to be able to put in front of you to say, okay, did this do what we thought it was going to do financially? Because you've already looked at the membership side, and you flip and look at the financial side. On the return on future investment, and this is a key part of any business plan, because you have to look at, if we did something else, what would that result in? What's the alternative here? And this gets back to a question that Member Daniel has raised on several occasions, which is, all right, how much does it cost us to have a MAP or sliding fee scale patient? How much does it cost us to have a Sendero patient? So we'll bring those numbers back, and they'll be revised, obviously, because we'll have fresher data, but we'll present that to you. So moving on, the risks section of the business plan. You've already seen some of the financial risks. You know what that is. This tries to in qualitative terms, identify certain risks and give you, again, on a qualitative basis, the control for that particular risk. It's things that we've already talked about, so there's really nothing new here that hasn't already been discussed. As best we can, we will try to capture data coming from the members themselves. And this is, what are your outcomes like? What is your satisfaction levels like? That is really hard to capture in an insurance environment because there's so much regulatory focus on other data collection that they have to do. But to the extent, and Wes, I put this in here as a placeholder, as I was talking about earlier, but, we're gonna work with management to capture what we can, even if we have to use some, sample surveys to be able to do that, because I think that's important to show, hey, this is what the patients are saying about this experience. Next are some key dates and timelines, again, leading up to June. And then the requisite approvals, again, that's probably not the best title section. It's not necessarily an approval as much as it is just acknowledging that this report was presented and that a recommendation was provided as well.
Managers, as Mr. Giesman has stated, this is an informational item only and no action is necessary. Does anybody have any questions? Manager Daniel.
I just wanted to make a comment. I wanted to thank you, Mike, for laying out this plan for us. When we voted to continue Sendero, at least for one more year, I think it was a pretty tough decision to make, and I, for one, recognize that while you laid out a plan or a proposal for a path forward, I think it's going to be a challenging year. I think it's going to be difficult to hit the marks that will keep Sendero viable going forward. So, I think given the situation, you've laid out a plan that I think is as reasonable as we can expect, and we hope that it works out as you and Wes intend for it to. And so I'm supportive of your plan. I think it's a good one, and I appreciate you laying it out in such detail. And again, I for one know that if this doesn't work for Sendero going forward, I don't know that I would think it's a result of faults in the plan. It's just, I think, a tenuous and difficult situation. And there's still future regulatory conditions that we may not even know about yet that may change. So, but thank you.
Really. It's a team effort.
Manager Jones.
Yeah, I'd like to ditto exactly what Member Daniels has said. I think this is a very good, it addressed what we asked for. And it gives us a roadmap to be able to evaluate and to make certain decisions on. I want to emphasize, though, Wes, that we still have the June 2019 date, at which time we have, as a board, have to make some tough decisions. So this was our effort to try and give you that opportunity. So I just want to reinforce that to you, so that we're all on the same page, so that come June, it's not, well, we didn't, those types of things. There'll be elements, I understand, but I think this helps us a long ways in terms of achieving that. So I'd like to thank you very much for this.
Andrew Reber.
Yes, and thank you for those comments. I certainly concur, and I want to thank you, Mike, for presenting this. We want to be as transparent as possible. Transparency is very important to us always with everything we do, and so I appreciate this full report and the transparency. It is a difficult situation, as has been alluded to, and we will have to see how it evolves for even just for 2019. Thank you.
Thank you, Manager. Anyone else? Manager Valdez.
Thank you all, but thank you, Wes. And I want to thank the board members for having given them this additional opportunity. But I'm always trying to see if we can try and help make this happen. And with respect to that, would you have the flexibility, Mike or Wes, or within your scheme of things and how we're pushing this through the process, to look at how we've had chat before. We've had chat every year. So if there was a way to streamline that process for chat members were MAP members who moved on to the Central Health Assistant Program and became Sendero members. So if necessary, would you all have the flexibility to be able to implement a similar type of recruitment process that has been used for the chat members before today, before this? It's the same thing, chat, MAP members being moved to chat. and seeing if there was a way to kind of streamline that process. You hit all the necessary, you cover your bases legally, but, you
Right.
know, because from what I understood in the past, they appeared to have quite a good deal of success in moving those MAP members onto CHAP before. I just want to make sure we're not creating additional barriers. You know, we have to cover all our legal, dot our I's and cross our T's, but, you know, the attitude or the facility, you know, the flexibility to be able to do that. That's all I'm asking for.
Yes, and understood, and I think given that this is an enterprise-wide effort at this point, and they've already changed the process, at least I know a bunch of little changes, but there's been one major change in the process, even in this testing period, to be able to make it more efficient. So for example, making sure they have the ability to contact Sendero directly, I think is a good step. So we're gonna continue to do that.
Okay.
And I don't know how often we might change during, right in the middle of open enrollment, but to the extent we don't have to reinvent the wheel, that's certainly first and
We have 2
foremost
weeks.
on our minds. Yeah.
So anyway, thank you all. Thank the whole team. And thank you all as my board of managers. Thank you.
Any other questions, managers? No? Okay, thank you all. Thank you, Mike.
Thank you, members.
Thank you, Helen. All right, agenda item 1, discuss the formation of a board subcommittee to make recommendations regarding board officers for calendar year 2019 and to discuss the process for election and appointment of board officers as described by the amended and restated bylaws of the Travis County Healthcare District. All right, tonight meant to start discussion on process for nominating board officers for calendar 2019. It's not posted for action, different process than in the past few years. Bylaws require the executive committee to form a subcommittee to recommend the board officers each year, including one member of the executive committee and chaired by the former chair of the board, which is Manager Daniel. We'll hold meetings of the executive committee and subcommittee for recommending officers back-to-back on the same evening prior to November Board of Managers meeting. We'll place the subcommittee's recommendation on the agenda for consideration by the full board the same night. Meetings posted so that all board members can attend, even if they aren't on the committee or subcommittee. And we will make sure all the members of the board have the opportunity to be a part of the process. Who am I passing this on to? Elizabeth? Is that Holly or you or anybody?
So it was just your update
Yeah.
on
Right.
the formation. No other presentation was planned.
And just discussion on the process and just to get feedback from the.
Okay, so am I gonna pass
No action.
Manager Daniel will be our chair of that committee. Does she choose her own committees? Sorry, come in, Nicole, sorry, Nicole, come up to the table.
So, what will happen is, it's actually in the bylaws, the executive committee selects the members of the committee to make recommendations for officers. The chair of the committee is the former chairperson, which is Manager Daniels. And the only other requirement in the bylaws is that one other member of the subcommittee is one of the other executives
Correct.
on the board.
Manager
And
Daniel.
so, go ahead.
So I guess what we've done in years past, and I would expect we'd follow something similar this year, unless you want to do something different, but, you know,
Well, I need to respect the bylaws, which is, go ahead.
right, so what we've done in years past is we will have an agenda item to nominate a slate of, or the nominations committee. And then the nominations committee posts a meeting, and then they develop and recommend a slate of officers. They bring that back to the board, and then the board votes on that. So
Which is-
I would think we would have another item maybe next month that
Right.
has.
Well, so in the past, we have had the nominations committee has been selected by the board. But actually, the bylaws say that the nominations committee is selected and formed by the executive committee.
Oh, okay.
And in the past, the reason I think we've done it
by the full board is we didn't
Oh,
have
we
a
didn't.
former chair who was
Yeah.
still serving on the board to
Or if we
actually chair
didn't
that
have,
committee.
if we didn't have other action items, I think,
Right.
for the that's, now that I
Yeah,
remember.
yeah.
So if we didn't have another reason for the executive committee to meet, we could just bring it to the full board because the executive committee is part of, so if the full board votes on it, the executive committee has voted.
Yeah, but just to not only expedite the process, but keep the board members from having to come to multiple meetings.
Yeah.
We were thinking, just doing, stacking the meetings, executive committee meeting to appoint nominations committee members, and then roll that up to the full board on the same day. And like Dr. Zamora said, all of those meetings would be open to all of the board members to attend and provide their feedback. And I think it's
Maybe
just
I'm,
kind
maybe
of
I'm,
asking for feedback.
maybe I'm confused. I thought we wanted to have the officers for the next meeting.
Right,
This
it would,
late already.
right, it would be before the next meeting, yeah.
So,
Manager Masato?
well, thank you. I know this was something of an issue that I probably had addressed in the past, the way of the selection. So are we, right now within the bylaws, the next officers are due for next year?
January.
January of 2019.
I thought it was at the chairs 2 years.
No, each of the officers' terms is a year. Typically, by practice, what we've done is had officers serve 2 years. So, but we elect them every year.
Oh, okay, so that was really the confusion that I had right now.
It's just traditional that we've elected folks 2 years in a
Well,
row.
the bylaws have 2-year
So what
term
about
limitations.
committees? Is that also
The
done?
chair determines the committees.
It's in the
The chair,
bylaws.
Well, the chair lays out usually a slate of committees and then the board votes on it.
Yeah.
Yeah.
No.
Nominations.
Specific board subcommittee, and so I can
It's
answer your
stated.
questions about that after. I just want to keep everyone on top.
Okay.
okay, thank you.
Sorry. I'll give everybody a call on that one. All right. Sorry.
That's the update. We'll,
Thank you.
Emily will be reaching out to the board to,
And you won't know this.
Just in case there's some people who may have forgotten what the bylaws look like, why don't you send everybody
Sure.
another copy, okay? Just in case there's a question,
yeah,
so
absolutely,
we can reread them.
absolutely.
Thank you.
I'll do
Did you have
that. I'll make
insomnia?
sure we get that
That's
sent
right.
out.
We slept between now and then.
Yeah, all right,
Thanks, Nicole.
you're welcome.
12.1.
All right, agenda item 2, receive a report of the preliminary September 2018 financial statements for the Community Care Collaborative. Mr. Canola and Ms. Owens.
Good evening. So I'm going to briefly go through our preliminary financial statements for the Community Care Collaborative. I'd like to just keep in mind, as we like to talk about at this time of year, it's very early for the numbers. This is our first draft. We don't expect any significant changes, but we are beginning our audit process, and you will receive the final year-end financial statements for both entities. Our target is to have that for the January board meeting. So those are considered final when our audit is complete. So this evening we have the preliminary report for the CCC. Our cash and cash equivalents at the end of the year, $36.5 million, with just a few other prepaid and receivables for total assets of $37.1 million. We did have liabilities, which includes our payments to providers that are due, estimated at $24.5 million, and then deferred revenue and some other liabilities, including payroll, combined with that accrual is a total of about $8 million as liabilities, leaving us in the CCC of net assets of $11.4 million, $5 million of which we keep as emergency reserve. Our sources and uses are summarized on the next page. Not significant change in the DSRIP revenue, but we did have an estimated year-to-date
actual of $59 million. There was member payments in the last month of the year in September. So our total member payments received from Seton were $36.3 million and Central Health $23.2 million. Our operations contingency to carry forward didn't change, and then some interest income. Total sources of funds for the year were $131.7 million. Our healthcare delivery expenditures were about 84% of our budget at $86.6 million. Our UT services agreement at $35 million, and DSRIP project costs at just under $4 million. Total uses of funds at $125 million. Our sources over uses is $6.4 million for the year. I believe we have talked in the past on multiple occasions about the DSRIP program and the timing, so that under budget there was known about in advance with the timing of the DSRIP program and the changes. Some highlights on the healthcare delivery program. Again, the budget was $103 million. At 84%, we have approximately $86.6 million in the fiscal year 2018. Our primary care is at 99% of our budget, with our primary care providers, which we'll go through in a little bit more detail, as well as our specialty care at 62% of the annual budget at approximately $8.3 million. We also have specialty behavioral health, which includes our large partnership with Integral Care for inpatient services, as well as medication-assisted therapy. And we have our specialty dental at about $384,000, as well as our post-acute care, pharmacy, medical management, urgent and convenient care. We also have a little more detail on the healthcare delivery operations at about $8.5 million, and we'll talk about that in a little more detail. So the total healthcare delivery in the preliminary draft is $86.6 million, which is about $12 million additional dollars year over year. As I mentioned, the primary care, we are at 99% of our budget. Our longstanding partnerships with our primary care providers are summarized there. Community Care, El Buen Samaritano, Lone Star Circle of Care, and People's Community Clinic. We did have an amendment to the volunteer healthcare clinic contract to increase that. It's now estimated to be at about $158,000. And then our School of Nursing, Prevention and Wellness, and EMS partnership. Total uses of funds for primary care is at $51.5 million, and that's about about $7 million more than our prior year expenditures. Specialty care, which we talk about in great deal, and I believe you're getting dashboards now around some of our outcomes related to these, and you've received updates from the CCC about the programmatic implementation of some of these that throughout the year. But our year-to-date actual is at $8.3 million, total budget of $13.5 million. I won't go through these line by line, but we've talked about some of the programs where you see that there's no dollars sent. Those programs had just not gotten started yet. So we maybe had budgeted for those programs, and those programs did not start. Some of our long-standing partnerships with community care and specialty care, as well as orthopedics and ophthalmology, you'll see that those programs performed very well in the reports you've seen about outcomes, but also that the expenditures were closer to what we had budgeted and planned at the beginning of the year. Year over year, I would like to point out we did have a significant increase in our specialty care spending through our expanded partnerships and programs from the community care at $8.3 million, and prior year at approximately $4.8 million. And finally, just a few highlights on the healthcare operations that are performed at the Community Care Collaborative. We have 6 departments shared here. performing services in eligibility and enrollment, our quality department, the PMO, the operations department, and of course, health information technology. Total preliminary estimate is $8.5 million on a $12.9 million budget, just slightly increased year over year. Prior year and in those areas was $8.2 million. With that, we are happy to answer any questions.
Thank you, Jeff. Managers,
Oh, okay.
Andrew Aldez.
Just for clarification purposes, on the healthcare services, delivery services page, approved budget for specialty care was 13, or let's say 13.4.
Yes.
But the year-to-date was only 7.5?
It was 8.
Through August, so it's almost full year, but we paid it out?
It was 8.3 million.
That's what she was referring to.
Through September.
Okay.
And so there's, to answer your question, there's two processes. One is payments throughout the year, and then we get to year end and we have to do an estimate. We're coming to you 15 days from the physical end. You actually have 95 days to file a claim through most of our providers and 180-day appeal process. I think I heard Mike say the other, in a previous item, that insurance sometimes is hard. It takes a while to get caught up. This is the same
Outside
thing.
payments.
So there's a 180-day period after the year end, which is the date of services. So they're really date of services through 9/30. We do our best to make estimates. So we're bringing estimates in this presentation, and we'll actually have estimates in our audited financial statements also.
I appreciate that, thank you. And then, last question, with respect to the sources of funds, this is for the CCC?
Yes.
So the member payment, this is as of August 31st. Did Seton pay any more?
Yes, they paid approximately $6 million more.
So it would be,
So from August to September,
well, before October 1st.
right,
58 plus
these
64.
financials were through September 30th.
So it's 36 million that they
Yes.
contributed?
That's correct.
But that's significantly less than the, 22 million less than what we thought, anticipated? Is that what it was?
What we budgeted.
What we had hoped to
Right.
receive? Okay. And I guess one last one with respect to integral care. Where is that?
We don't have a detailed outline of the specialty behavioral health. But the specialty behavioral health I was just highlighting includes our inpatient partnership with Integral Care, which is a lot of that information.
Okay.
And that's about $8 million.
It's an $8 million partnership.
I thought we had a little bit more. I thought we had like 10 or, no?
Not in that program.
Yeah, no, we have about $8 million for inpatient beds. And then we have our
Medication
assistant therapy program.
Okay. But for actual, since we're now we're in the new fiscal year, they would have gotten their 100%.
No, we'll start reporting services as of October 1st. Moving forward, we'll go in fiscal year 19 and would be reported next month, but it's in a different fiscal year.
Okay.
Fiscal year 19.
Okay. Thank you.
Any questions about Court Manager Aldez?
No, that's it. Thank you.
Manager Daniel or Jones?
No.
Manager Jones?
Oh, no, I don't have anything.
I just have a quick question on sources of specialty care. Do we find, or how do we address neurology services? Is that, I don't see it listed here, so how is that? Yeah, that's been a service line that has had, so we've had to start out with some specialty service lines.
That's a service line that we have not expanded out into this community care collaborative. Neurology is a specialty line that's required to be provided through the Seton agreement, the specialty
Okay, so
care.
that's where it's, okay.
What you see here is mainly the expansion of specialty care services.
Okay. All right, that was it.
Any other questions? All right, Jeff, Lisa, thank you. Agenda item 3, receive and discuss reports from the board committees, Central Health Downtown Campus Committee and Budget and Finance Committee. Daniel? Anything from the downtown campus?
We met, when was that?
2 weeks ago,
Yeah,
week and a half.
right, I feel like I've slept since then.
Really?
It's on my husband's birthday, so October 11th.
Yeah.
Well,
Yeah, it was
I
2
there.
weeks ago.
At a
Yeah.
conference in Atlanta. Yes, that's right. I was at a conference in Atlanta,
It's
so
all
yeah.
in there.
Yeah. And I think we see.
It was just the three of us.
Yeah, it was a pretty small meeting. We received an update. There was anything particular that,
We had we had a very general update on what was going on with BRAC, and then there was a related discussion in the real estate strategies that would involve BRAC and the extent of it.
it was kind of a broad, I think, conceptual direction forward discussion.
Right.
Okay. As far as the budget and finance, everything was presented today, so nothing new other than that. All right, I'm gonna take a chairman's prerogative and do another PSA. Everyone watching, please go get your flu shots. We had 80,000
Yes.
flu-related deaths last year.
Done.
All right. Is that- What's that?
And vote.
All right, no, not yet. Agenda item 10, confirm the next regular board meeting date, time, and location. The next Central Health Board of Managers meeting is scheduled on November 28th, 2018, at 5:30 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And before I adjourn, do we need to include the executive meeting as well? No? All right, thanks, Nicole. All right, now I'll entertain a motion to adjourn.
Adjournment.
Second.
All right, all in favor, say
Aye.
aye. I don't think anybody's gonna say no or abstain. Board
Sorry,
manager
I think I
say-
voted.
Missed on my committee update. I totally missed that item, and I usually collect my thoughts.
Thank you, manager.